All right, so now we're going to be measuring the goniometer, using the goniometer to measure the shoulder flexion of a patient. In order to do this, you need to take the goniometer, position it at the shoulder joint, and have the stationary arm parallel with the table and or whatever surface that you are on. And then the movement arm is going to be lining up with the humerus and keeping all along that line. So when the time comes, you're going to have your patient raise their arm as high as they can up towards their head, up until they start to recruit the muscles in their back to use them. Once they start recruiting muscles, you need to move them back to a previous position to see how the full extent of their shoulder flexion. So can you go ahead and flex your shoulder for me? Just bring your arm up. Keep going. All the way. Keep going, keep going, keep going, and stop. Right there. See, it's starting to engage his shoulder muscles a little bit. So then you would be able to use stationary arm, measure it with your shoulder joint, and he has 135 degrees of flexion. All right, so now we're going to be measuring the shoulder extension of a patient. So very similar to the shoulder flexion, your movement arm is going to be lining up with the humerus, and your stationary arm is going to be lining up with the table, making sure it's parallel. When the time comes, you're going to ask your patient to extend their arm or flex it backwards. You can go ahead and raise it into the air, please. And line it up with the humerus. Make sure that they're not recruiting any of the extra muscles to get a little bit of extra movement. All right, you can go ahead and relax. We have 17 degrees of movement. So now we're going to be measuring shoulder extension, shoulder internal and external rotation. In order to do this, you would have their patient lie flat on their back and have their elbow in this position out to the side with their arm raised into a perfect vertical here. That perfect vertical is going to act as your stationary arm for the goniometer. And then for internal rotation, you would have your patient move their arm forward as far as they can without recruiting, and use your humerus as the bony landmark for the movement arm. Is that as far as you can go?
Sure.
All right, then there's 70 degrees of movement there. Bring it back to the center. Make sure they recenter their arm. And you can go ahead and flex it for external rotation. Right there. Make sure you're following the perfect vertical. And you have 65 degrees of motion in that direction. So now we're going to be measuring elbow flexion of the arm. In order to do this, you would position your stationary arm, make sure it's lined up evenly with your head of the humerus or your deltoid or your acromion process up here, and make sure that the axis of movement is even with the elbow joint. And then you're going to be lining up your movement arm with the radius down in your forearm. And it's also important to note that when you're doing the range of motion, you're starting at 180 degrees here and moving it back to center, up, so and forth. So you might have to do a little mental math to go in there. All right, when the patient is ready, you're going to have them flex upwards. Keep going. Yeah. And go all the way right here. All right, and there's 30 degrees left, which means that the patient moved 150 degrees. All right, so now we're going to be measuring the hyperextension of the elbow joint. So you're going to have your patient bring their arm out into a horizontal movement. Make sure that the axis of rotation is right on your elbow joint and your stationary arm is even with your humerus. And then your movement arm is going to be lining up with your radius and or your ulna. And then you're going to have your axis of the patient to go into hyperextension, like so. And moving off, it's about 9 degrees of hyperextension. All right, so now we're going to be measuring shoulder abduction. In order to do that, you're going to position your stationary arm at the perfect vertical, and then you're going to use the axis of rotation right here at the shoulder joint, and then your bony landmark is going to be the olecranon process and or any sort of part on the humerus that will stay stationary. When the time is ready, you're going to ask your patient to raise their arm laterally as high as they can, and make sure that they're going as high as they can before they start recruiting other muscles. So right about there is when they start recruiting other muscles, so therefore the rotation is over. Make sure it's all lined up properly, and it is 145 degrees of motion. All right, now we're going to be measuring ulnar and radial deviation of the wrist. In order to do this, you need to place your axis of rotation right here at the base of the wrist. Your stationary arm is going to be the ulnar or forearm, and then you're going to have the movement arm equal with your middle finger right there. And then you're going to have them do ulnar deviation as far as they can go to the left. Good, that's about 35 degrees, and go back to center. And now we're moving it over to the right as far as you can go. And that's about 22 degrees. All right, now we're going to be measuring wrist extension and flexion. So you're going to have your patient hold up their arm horizontally like so, making sure that the wrist is horizontal with your forearm. Your movement arm is going to be onto the edges of the finger, and your stationary arm is going to be equal with forearm like so. And then you're going to be using the distal phalange of your middle finger to measure it. And when you're asking your patient to extend or to flex, you want to make sure that they keep their fingers straight at all times. So I'm going to have her move into wrist flexion, up like so. Make sure it stays equal. Good. That's about 50 degrees of flexion. And then we're going to move into wrist extension here. And that's at about 55 degrees of flexion. Back to center. All right, now we're going to be measuring wrist pronation and supination. In order to accomplish this, you have your patient place a straight object in their hand to use that as the movement arm, and your stationary arm will be your perfect vertical. And then you'll have your patient move into pronation, like so. Make sure the axis of rotation is equal with the wrist, move as far as they can. And that's at about 100 degrees of rotation there. And go back to center. And then we're going to move it over to the left. This would be supination right there at about 130 degrees of rotation. And back to center. All right, now we're going to be measuring shoulder horizontal adduction of the shoulder girdle. So in order to do this, you place your goniometer at the axis of rotation of the shoulder joint, have your stationary arm be parallel with the floor, and have your movement arm be parallel using the bony landmark of your humerus. And then when the patient is ready, you would have them move into adduction, slowly moving upwards until you start to notice that the patient is recruiting their other muscles in order to assist them right about there. All right, so in order to measure horizontal adduction of the shoulder, you need to take the patient and have them place their arm at a horizontal angle here, and then make sure the stationary arm is parallel once again, just like in a adduction. And then you would have them flex their shoulder backwards as far as they can using the humerus as a bony landmark, and then you can go ahead and relax. And the measurement is at 45 degrees.